Yeah. You have any questions, please let me know in between. I like to take in sessions questions in between because it helps the learner and it helps ourselves also. So yeah, welcome to this unit. I'll quickly go through what we've covered already, and then we can move on from there. So I had briefly talked about what is expected of you from for this course. It is the course, the unit is social and community welfare provision. So here in the first, learning outcomes. So we have LOs. These are learning outcomes. We would want to understand the factors that influence health. So, if I could ask you anything that you think, what could be the different factors, any one factor that you think is most important that impacts health or influences health? Anyone?
Could be the lifestyle that people live in.
Okay. Very good. Yeah. So you could have an active lifestyle. You could have a lifestyle that is sedentary, that is not active. Yes, that could impact health. Very good. Anything else? Do you know what social determinants of health are? So, because we're talking about social and community provision, so there are certain social determinants of health. So they determine health. There are certain social factors that make you healthy or unhealthy. So we are mostly focusing on those within this unit. So let's say your employment or your level of education, or let's say the place where you are living, the house that you have, your status, they also are a determinant. They influence your health, unfortunately. So we're going to talk about these in further detail. So a bit about the key terminology. So what is community and social and community welfare? We've gone through this all yesterday, but I'll just give you in a nutshell over here in the UK. So there are different examples of them. So we have healthcare assistance, we have certain food provision in the form of food stamps. You have compensations for those who are unemployed. And then there's a social welfare law within the UK, which is termed as poverty law if you see it internationally. Within the UK, it is known as social welfare law. So this also helps or supports people with low incomes or people who are disadvantaged, people who have a disability. What is the main objective of them? To help the underprivileged. So you are all at the same level. So you could be underprivileged because of your disability, because of being unemployed, or because of having old age, or because of these things. So this is why the social welfare exists. This is a small video. I'm not going to turn it on right now because of time constraints, but I'm leaving this in the chat box. I've just opened up a chat box over here. So in your box over here, so you can have a look at this video in your own time. So just save this video. Yeah, just save this video with yourself and just have a look at it whenever you are free. So yeah, this is the video link. The second one, I've sent the second one. So the first one, I think it's not right. Yeah. Delete. I've deleted the first one. So you can have a look at this second video. I hope you've got it. Yeah. So just have a look at it. It shows it talks about community-centered approaches. So what are community-centered approaches? They're focusing on the community instead of on the people who are in the hospital. So we believe people who come to the hospital, they're just the tip of the iceberg. The real burden lies within the community. So when we have our community-based approaches, we know more where to focus on, actually. So what are community health services? We've talked about them earlier. So some of them are providing urgent community response, including 2-hour rapid crisis response services. You have district nurses there in the community. You have child health services. You have community OT or occupational therapy, wheelchair services, and health visitors. All of these work in the community. And so if I'm going too fast, don't worry. I've gone extremely slow in the video that you'll get on Monday. So you can have a look at it if you want more details. So some examples of social welfare we'll talk about within the UK. So the most widely used is cash benefits. So they make up the most of the gross domestic product, which is 10%. And the only problem with this cash benefit, so there are different types of social benefits that the UK government has provided for those who are underprivileged. So amongst those, there's some personal social services, but the most common one is the cash benefits. The only problem with this is that if you have cash benefits, like you have pension benefits, they're very less compared to when you're actually working. So your working salary is more compared to your benefits, your pension benefits. So people, obviously, then that becomes that leaves you at a disadvantage again. Then there's healthcare. So you have the NHS, which is taxed, which has taxes there, and then most of your services there are free of cost. And then you have education, which is free to all children through the ages of 5 to 16. And when the child grows older, obviously, then it becomes, you have different scholarships, but at times this is out of pocket payment, which becomes a bit expensive for some families. That is why children, they're moved from their education and then join the workforce, which is unfortunate. Public housing, again, people who are underprivileged, they have council-owned rented houses, which is a big support by the local government. And then you have, okay, we're all comparing this to other countries. So if you compare UK to other countries, you're not comparing it to underdeveloped or underprivileged countries. You're considering it amongst the developed countries. So UK has these provisions, the United Kingdom has these provisions for people who are underprivileged. Then you have a change in the UK population. You have more of elderly people who are living for longer periods of time. So they need more assistance and more services. So the demographic problems are changing. So you have more diabetics, you have more people suffering from hypertension compared to younger children suffering from other ailments. So most of the chunk goes there. So there's this very long timeline that I shared yesterday, and it's given in a lot of detail in the video that I shared yesterday. What you have to see in this, what happened at different, these are the different milestones within the community health services. So starting from 1948 and ending up till 2016. You have all this timeline. I'm not going into detail, but it's for you to look at, to hear in this video. Any questions that you have based on the video or this presentation, please feel free to ask me. If I have the time, because I'm just conscious about time, because I have to complete this learning outcome with you. So please feel free, but this is something that I don't have to explain to you. It's if you can read it on your own. Just about the community-centered approaches for health and well-being. So there's communities, this is an umbrella term within which you have strengthening communities. You have one component on volunteering and peer roles. You have another component on collaborations and partnerships. And then the fourth one is access to community resources. So within strengthening community, you have components as community development, asset-based methods, social network methods. Within volunteer and peer roles, you have bridging roles, you have peer interventions, peer support, peer education, and volunteer health roles. Within the collaboration and partnerships, so this is collaborating and having partnerships within the research domain, area-based initiatives, community engagement in planning and co-production projects. And the last one is access to community resources. So you have partnerships, partners to participation, you have community hubs, you have community-based commissioning. So all of this is heavily community-based, and it's all for health and well-being of the community. The timeline I've mentioned. So this timeline is important to read through because you have your assignment which talks about timelines, which asks you to draw upon timelines and show a difference between how the healthcare works now compared to previous years. So because I showed this to you yesterday, what is expected from you in the course. So just have a look at this timeline. It will be helpful while you're doing your assignment. So in 1986, we ended over here. There was this Sir Roy Griffiths report. So it's also known as the NHS management. So NHS, the National Health System, has gone through various sort of reforms based on a lot of data that showed that there's certain things that had to be changed. And this report, which was authored by Sir Roy Griffiths, he was the management consultant and former director at Sainsbury's. So the report made a number of recommendations. Those were there for improving management of the NHS, which included introduction of a more business-like approach to healthcare management, and there should be development of clear lines. So accountability should be there. There was no accountability initially. And there should be a greater efficiency, and the cost should be controlled in a better way. So resources are controlled in a better way. This report wasn't agreed upon earlier, but then it is often cited as an important document in the history of the NHS, and it laid the foundation for the NHS management in itself. And then you had the Marmot Review. Marmot Review is very, very important whenever you're citing health inequalities within England. Sir Michael Marmot, he was a public health expert and a professor at the University College of London. Very important report. It examined the social determinants of health. I just mentioned the social determinants of health and how do they impact, how does social and economic inequalities, how do they impact health outcomes? So everyone has health issues, but how does your society or your economics impact your health? So this report found that people who are living in the lower socioeconomic statuses, or they're living within the lower socioeconomic strata, they have very bad health outcomes, worse health outcomes. They live for shorter durations compared to those who are living in the higher socioeconomic groups. This showed that health inequalities were increasing in England despite all improvement in health outcomes. There were a number of recommendations that came from this report, which included reducing poverty and social exclusion, improving education and employment opportunities, no matter what social or economic status you belong to. You need to make it equal for everyone. And then promoting healthy behaviors. So the report also called for greater investment in early years education. So early years education, obviously, it was there for those who could afford it, but not there for those who could not afford it. So there should be greater investment in early years education, public health interventions, and social welfare programs. This was a significant report. and it raised awareness on social determinants of health. Also, it influenced the development of the Health and Social Care Act in 2012, which came after 2010, obviously, this report. And this Social Care Act, which was introduced because of the Marmot Review, it aimed to improve health outcomes and reduce health inequalities in England. Its main focus was here. Any questions, please raise your hands. I always appreciate it. So always make sure that you're a part of the class and not staying passive. Any question, any type of question, please let me know, okay? And then the NHS, the National Health Service. This provides comprehensive healthcare, which is throughout the United Kingdom, and it's got primary care services, hospitals, and community health care. So there are three layers. The main element in primary care is the system of GPs, who are called family doctors, general practitioners. They provide preventive and curative care, who refer patients to hospital and specialist care services if required. Otherwise, they deal with the cases on their own at their own end. All consultations with a GP under the NHS are free. Some other major types of primary care, there's subtypes. So they're dentistry and pharmaceutical ophthalmic services. These are only services for which charges are they're reduced, and for persons under 16 years of age, past retirement, or low incomes. Otherwise, people pay for them. And then under the Department of England, there are 4 regional health directors who oversee area, the area or the health authorities, and they're mainly responsible to run the hospital services. So they're in Scotland, Wales, Northern Ireland. It is responsible of their respective parliament or assembly. So there are hospitals that absorb more than 2/3 of the NHS budget. So there's a big load that goes to hospitals. All hospital treatment within the NHS is free. This includes all consultations with any specialist that you require. And hospital doctors are paid a salary rather than a fee for service. And then you have community health services that have 3 basic functions. They act as a link with the local government, these community health services, especially when there's public health concerns. Secondly, they cooperate with local government, personal social service departments in order to enable health, and also provide personal care to be handled together wherever and whenever possible. So I'll share this video later. So what are contemporary issues in healthcare? We've talked about, like we were mentioning, the contemporary issues in healthcare. So the main issue that we highlighted was the aging population. So a population that is aging, so obviously you have more of diabetics, you have more of people who are suffering from hypertension, which gives rise to heart diseases, you have more strokes, you have all of these conditions that are chronic conditions, mostly that last for a longer duration. The top line facts on big issues are the nation's health, NHS performance and waiting times, health and social care funding, health and social care workforce. These are the big issues that we are facing because of these issues happening in the healthcare. So, so I told you that it's very important to engage with communities. Any one of you who's working in the community? Is anyone working within the community?
No, me.
Okay, so what's the reason? Why do communities matter? So it's obviously to reduce health inequalities, engage those most at risk of poor health, and empower people to have greater say in their lives and health, and create connection, resilience, and more cohesive community. So what I said to you, it's a tip of the iceberg that you see in the healthcare setup. whether you're working within social care, you're working within a hospital care, whatever you are seeing, you're just seeing the surface. What lies deep down below, it's the main chunk. So there are many people who are not accessing these facilities. Either they don't have the means to access them, or they're too, or they've tried a lot. Let's say mental health. So there are a lot of mental health issues that exist within the community. There's still taboos that are around them. You don't talk about your anxiety, your depression in a public area. I wouldn't speak about my anxiety with you, but if I'm a diabetic, probably I'm going to speak about my diabetes. So I consider diabetes more speakable about compared to if I am suffering from a mental health issue, because that still has a taboo. So that should not be the case. So that is why mixing with the community, being in touch with the community is so important. So positive health outcomes, they can only be achieved when you address the factors that protect and create health and well-being. And many of these are at the basic community level. So community life, social connections, and having a voice. So these people don't have a voice because they can't reach you. You're not reaching to them. They're not being able to be heard. So this is why there's that communication gap. So they build control and resilience when you're communicating with them, and they help buffer against diseases. So you're going and protecting their health, preventing against health adverse health outcomes. A diabetic might not know that he's a diabetic. You might go into the community, just do a random screening, and then find out, oh, there's 10 people in this household who need treatment and who don't even know that they're diabetic because they didn't realize. And there's a lot to do with your level of education and what language you speak, which community you belong to, which ethnicity you belong to. So there are a lot of issues. These are all social issues. These are all socio-economic determinants of health. So community-centered ways of working, they're all important for all areas of public health, which include health improvement, health protection, and healthcare and public health. So when you're involving and empowering local communities, particularly the disadvantaged groups, this is very important. So you have the National Institute for Health and Care Excellence, which is the NICE, and you have guidance on it. So there's a lot of emphasis on by the NICE guidance for health improvement, particularly because it leads to services that better meet the community members' needs. It is very important to stay connected. So there was a community life survey 2016 to 17 that found that 5% of adults in England reported that they felt lonely often or always. And this has remained unchanged since 2013. And this community, and if you see this survey happened, the report came out in 16 to 17. And long before that, they remained lonely, and that has remained the same throughout the years. But not all of the people have someone to rely on. So they're dependent, but they don't have anyone to support them. Over half of them stated that they feel lonely hardly ever or never, which is something good, obviously. But then how would you find out about this? This was through this community life survey. And health inequalities persist, and many people experience the effects of social exclusion. And there's lack of support. So this Marmot review that I mentioned, it provides the evidence and it shows what the reasons are behind this social isolation. Once you know the reasons, this is how you're going to reduce them. You can't eliminate them, obviously. So there's a social gradient. So there's a high socioeconomic status, middle, and then low. There's a gradient, and the gradient itself, it impacts your health outcomes, which is very, very unfortunate. So how do we build on the social capital and community-centered approaches? This is an edition of Health Matters that focuses on the use of community-centered approaches. What are those approaches? So they're not just community-based. They also mobilize assets within the communities. They promote equity, so everyone has a chance. It's not giving equality. Equality means everyone gets an equal chance. No, we don't have unlimited resources, so we're going through equity. Equity means who deserves it the most would get a chance first. And you increase people's control over their own health and life. So people, you're not feeding them their you're trying and building on them, on their own strengths, and then they can make decisions on their own for their health and their well-being. So the family of the community-centered approaches, it has been developed as a framework to represent some of the practical and evidence-based options. These can be used to improve community health and well-being. It includes 4 strands of community-centered approaches for health and well-being, which are, the first is strengthening communities. Then it is volunteer and peer roles. We've talked about this in the figure that I showed you earlier. Collaborations and partnerships and access to community resources. So they're all important and they all make up a family of community-centered approaches. So most of the local authorities within the United Kingdom, they work on community-centered ways of working, but they have challenges because they have, obviously, there's a hospital setup. How do you bring from there? It's obviously a big chunk going to the hospitals. How do you create a system that has equal focus or more focus on the communities? So this is something that needs a lot of restructuring. And that is why you're being trained in it. So then there are key issues that we want to express in contemporary society that have an impact. This is also a part of your assignment. So that is why these have more focus on this. So health inequalities, we've talked about those who have poorer health outcomes. They most likely are suffering from poverty, lack of education, and unemployment. So people who are living in poverty are more likely to experience poor health outcomes than those who are living in higher social and economic conditions. They have more mental health conditions happening because of where they're living, how they're living. So all poverty, lack of education, unemployment would have an impact on your mental health. But this is again because of your social deprivation. And then you have an aging population. We've talked about this, that the demographics is a study of the population, how it is structured. So the number of population, the number of people, the number of older people, the number of younger people, this is all demographics, the numbers of people, and this is a whole study in its own. So UK has an aging population. There are more people who are getting older, who have diseases that are associated with older ages compared to those who are younger. With the lifestyle in the United Kingdom, so if you're employed, you're obviously you don't have time to cook your meals, you don't have time. This is for those who are employed. So the lifestyle here is more with obesity, and there are more children also who are being overweight or obese. Okay, why more children? Can anyone tell me? I agree it is for older adults, okay. Their lifestyles are changing. Why for children? Any reason? Any one reason that anyone can pick up? You all have children around you.
Yeah. I think for children, it's because they can't control themselves or they can't choose what to eat. They don't know anything about the calories or the bad side about food. They don't understand. They don't have enough understanding about what they are eating or what they're supposed to eat or what they're not supposed to eat.
Very good, Esperance, but that's our fault, isn't it? That is our fault. You've raised a very important point, but there's one more very pressing issue that Probably you've not mentioned.
It is our
More screen
responsibility.
time. More screen time. Would you agree with that?
Of what,
You're
sorry?
giving more screen, allowing more screen time. So children are not physically active.
Yeah.
They're spending more time on their screens, which then makes them obviously not run around. You know, where I am, the age that I belong to, we didn't have screens. Luckily, we had screens, but we were not as addicted. We didn't have the mobile phones. So all you have children doing is not playing around, and just give them a mobile or a tablet, and that's all that they need in their lives. That's all that they're doing. You can give them their tablets for hours, for the whole day, and they won't get tired of it. So this is one very, very important. I agree with you what you've said. Yes, they don't understand. And that is our fault, because we're feeding them with that. We have to encourage healthy eating, but we have to decrease screen time as much as possible. I know it is very, very hard, but it has to be, because you see, we survived it. We survived boredom. We survived being without 5 or 6 toys and having to play with just one toy. But these children now, they need more and more. So this is something that has to, because obviously if there's obesity when they have it since younger stage ages, there are other health problems that are associated with older ages. So they're more prone to develop heart diseases. You're having heart diseases in 30 and 40 years. And people are dying of heart diseases because of even if they're healthy enough, people are dying because of these conditions. So having said that, and then there's social isolation, which is a growing problem. So social isolation is also linked to poor mental health, and can have a negative impact on physical health as well. Can anyone tell me, during COVID-19, there was a very big rise in suicide attempts and mental health issues? Can anyone tell me the number one reason for this during COVID-19? Any guesses?
Isolation.
Yes, social isolation.
Yeah.
Definitely. So the number of people who died because of committing suicide was because they were socially isolated. You couldn't see people. You couldn't live we're living in the same house. You couldn't live within the same room with each other. So that had a big toll on people. So that this was a big issue on the UK healthcare system, and there's increased demand for services and a need for new approaches to healthcare delivery. So when you address these social issues, it will be crucial sustainability of the healthcare system in the future. Then there's discussion on how these issues affect or impact health and well-being. We've talked about health inequalities. How would they impact? So you would have a range of health problems, because if you can't have access to good health, obviously when you're living below the poverty line, you would not have access to um, health improvement facilities. If you're suffering from a chronic health condition like heart disease, diabetes, or cancer, you don't have the access to treatment over there. So all your treatment is obviously free of cost, but there's some treatments that are not free of cost that the GP can't see. You have to pay an amount for it, but if you can't pay, you can't access those services. So that's something to worry about. And then mental health problems, they're increasing in the UK. They have a significant impact. It's our lifestyles that have changed. Mental health problems can lead to feelings of isolation. You are depressed, you are anxious, other health issues which have a negative impact on the physical health as well. And then you have your aging populations, which require more longer term care and rehabilitation, more resources and that's putting a big strain on the healthcare system, which is already so overburdened. Obesity, again, if the people suffering from obesity, you're treating them, their future diseases, you're treating their, obviously, you need them to be physically active, you're giving them resources for that also, but you're preventing their other conditions, or you're treating their other conditions, because these people are prone to develop a lot of other diseases also. So you're having, and they're reducing, these conditions reduce their life expectancy, and their quality of life is also impacted. Social isolation, again, people who are socially isolated, they're experiencing more mental health conditions, which become physical health conditions as well, which leads to high blood pressure, heart disease, diabetes. So all of them are connected one or the other way. When you're addressing these health issues, obviously, it's very important. And the only way to do is to improve on this social gap that exists because of poverty, because of your social status, which leads to a lack of access to healthcare services, etc. These are some of the references that you could access. The very important references, some of them that you would want to focus on when you're doing your assignments. You have certain ebooks that are there on Moodle for this unit, and they're all available on in this presentation. You'll have links to the presentation and the videos also on Monday. Any questions or queries that you have? We don't have a door here, but we have an open, have a sudden question that you want to ask, and you're not being able to make it to the center. So you can always email us here. Otherwise, you have the WhatsApp numbers. So we've just completed the learning outcome 1, which so sometimes I always lag behind with the first learning outcome, because I have to give a brief overview of this I'll just stop recording if that's okay. Just pause this. Yeah. Just a minute. Stop recording. Yeah. So you have access to all the recordings, and that's not an issue for us. So once, obviously, when we're done with all these sessions, the 4 learning outcomes. So once we're done with these learning outcomes, you would then have your assignment discussion. Sorry, I'll just share it with you again. So this assignment discussion, I've shared a bit about what we're expecting from you.